Hypertension has been described as a silent killer disease. In Nigeria, a recent report from the State of Health of the nation by the Federal Ministry of Health states that 4 in 10 adults in Nigeria are hypertensive. The real silent killer disease here is not just the disease itself, but the cost of staying alive. Welcome to The Cost of a Heartbeat by Lisdale. I am Victor Enyila, and with me is
Philip. Today we are at the primary health care in Kuje to ask hypertensive patients about their lived experience.
Let's go, guys.
My daughter came to be sick. I told my wife to carry her to the hospital, but my wife insisted that I should follow them to the hospital, which I did. Written there, after the explanation of both of them, we were about to leave. The doctor requested me that I should sit down. Then she said I should bring my hand, which I gave her. She tested me. She said, okay, you have a hypertension. But I don't have knowledge of anything like hypertension then, because I didn't feel anything in my body.
The biggest struggle is, you are going to pay, and you are struggling to be sure that the money you have with you can actually take you there and come back with something. And most often you think about children's school fees, you think about the food in the house, and then you also think about the issue of your pills to keep you healthy. Sometimes if I have to skip my pills for the bag of rice several months, that's what we have to do. Because there are people at home who have to eat and the need is urgent.
If you don't have, you ask for help. Because if I'm lacking, my friends, if I ask any of my friends or my children, my relations, they do help me.
Sometimes you don't have to wait till maybe you get money. You have to go to the hospital with faith.
Yes, I'm aware, but actually the health insurance, the one I used to go, I had one while I was still serving. But after my service, the whole thing was just, they don't want to attend to me anymore. They are asking for extra funding, which will be coming from time to time, which I cannot afford.
And when I left, even if you are bringing that, take that card to the hospital, they used to back me. They don't give me good attention. So from there, I make U-turn to private clinic. So, it used to help me a lot. Anytime I go to Tufo, I'm welcome.
In this country, Nigeria, we know that there is so much effort, so much money being put into the communicable diseases all over, especially for the under 5 and maternal health. That is very good. The non-communicable disease is no more for the old. It's for the productive age now. We're told that about 70% of those who are having non-communicable disease are people who are less than 70 years old. So it's a problem, and very soon it will be an epidemic.
So if government can fund the medicine to be given the mostly old age people,
they need to, kind of develop policies that should enable people to get services. Policies that are positive to non-communicable diseases. For instance, not only policies, but also implementing activities. Somebody should be able to walk into a primary health care center without card, without anything, and just check his BP, free of charge, without anything attached to it, or any of the government hospitals, or even private hospitals. Somebody can, he just go there, can I just check my BP, please? That's all. Even those in the policy makers, the National Assembly, those who are working with the government, many of the people are not aware. And that's why some people will just collapse in their offices. Something just happens. This man has just collapsed. And that problem has been there. He didn't know. So there's a need for intensive effort.
The evidence is clear. Patients have a voice, and they're asking for sustainable financing. Lisdale, through the Advocacy Partnership for Hypertension Financing and Patient Voice Project, with support from the Global Health Advocacy Incubator, is calling on the executives, the Federal Ministry of Finance, as well as the Budget Office of the Federation, to release the 2025 and 2026 health budget in order to keep our health centers functional. This is also a call to the lawmakers to ring-fence health taxes for non-communicable diseases to help subsidize essential medications and fund programs and initiatives around hypertension, because a healthy heart should not cost a fortune.